Papua New Guinea has some of the worst health statistics in the Pacific region. It also has one of the world's highest rates of gender-based violence. Women and children are often targets of physical and sexual attacks. In 2008, an Australian government study concluded that 55% of the women in PNG had been forced to have sex against their will. MSF saw the need for better medical care for survivors of gender-based violence. It opened the Women and Children Support Center in Lae, the second largest city and biggest harbour in the country.
Most women that come in, they say it's an answer to their prayer for a center like this. I mean, for like so long, they've been going through this. You can't believe other ladies come and say, we've been going through this for 17 years. They're so happy there's a center here.
The Women and Children Support Center is right next to a hospital and opened in December 2007. MSF staff work closely with the hospital's outpatient clinic to offer medical and psychosocial care. The hospital lets MSF know when a sexual violence case is admitted.
We're still working on that.
Only 6 months after the clinic opened its doors, the team treated its 1,000th patient. The clinic also sees those suffering emotional trauma and family crises.
For me personally,
the situation is there, but many people are not talking about it. They're not coming up front. We only see a handful of people that are brave enough to come out, or anything that happens that is publicly seen, then they bring it here. But otherwise, the situation is, it's there in the communities, but just that people are not talking about it.
Many women in Papua New Guinea live in a state of fear of sexual attack. Children endure regular beatings. The causes of this widespread violence are complex and poorly understood. Most people here know little about the negative health impact of domestic violence. Some accept it as part of their culture. The MSF team raises awareness through schools and community groups and other organizations. Outreach workers like Adam, a famous captain of the Lae Bombers rugby team, go to schools to talk to children about violence.
Men, we always think that we are boss in the community. We do all the decisions are right. Because in our country, it's been traditionally that men are the boss. When I joined in and I find out that really there's not only the men who runs the family or the community, even the ladies are there. So sometimes I go around, I was like myself, sometimes I was not good when I didn't join this association. But after I joined in and I found out for myself that ladies have the chance at least to say and make decisions for the family and the community and country as a whole.
This is the time we have to change this gender equity. Most women come in, they look and they see that thing there and they go like, oh, that's what everybody should know about gender equity.
Thanks to a group of devoted staff members, outreach workers, and community members, more men, women, and children in Lae now have access to medical care and mental health counseling. MSF hopes to inspire the government and other agencies to make adequate health care treatment for survivors of violence a reality in PNG.